The Provider Development staff at Buckeye Hills Regional Council welcomes Passport and Older Americans Act providers to this training session. We will be covering the topics of qualifications for homemaker and personal care employees, as well as some other updates. My name is Rhonda Varhola. I am the Provider Development Risk Assessment Manager. I am going to start with the personal care service requirements. Then Erin Davis is going to continue with homemaker requirements, as well as updates on the progress of waiver alignment, what we know so far, and what's coming in the way of EVV, electronic visit verification. The PowerPoint slides follow along with the rules that are current at the time of this recording, March 19th, 2019. This training is not intended to take priority over the current rules, but is to serve as a helpful guide. Our wish is for you to be successful, so we want to provide you with as much information as we can to keep you on the right track. This session focuses on current rules pertaining to qualifications and other employee requirements. Remember that it is your responsibility to follow all aspects of the rules and regulations required under ODA provider certification for personal care and homemaker services. We anticipate that you may have questions after listening to this presentation. Please do not hesitate to reach out to us. Our email address is listed on the next slide for your convenience. Along with our email address, you can see our provider staff names and titles. Please refer to the documents provided while viewing this presentation. We have provided a copy of the PowerPoint, current OAC rules and regulations, and our review tools. This is a free mandatory provider training, and verification of completion must be submitted by close of business April 17th, 2019. Once completed, send an email to confirm. Include your name, title, the agency you represent, and the date you completed the training. You will see the Ohio Administrative Code rules referenced in this slide, with the dates and listings of when these dates were, or when these rules were effective. Sometimes when we come out to your facilities, we may see a copy of old rules that are outdated in your binders. Please review the current rules and place any old copies that you may have, replace them with the new rules. Review the current rules to make sure you are in compliance. Background and expectations. We did email a memo to all personal care providers regarding the rule change in May of 2018. Please ensure that we have a current email address for your agency if you did not receive this email. The Passport Personal Care Service Rule was updated effective 5/5 of 18. It is very important that all employees that you have hired on or after 5/5 of 18, they must have documentation in their record to verify that they meet qualifications to serve individuals as personal care assistants and as homemaker aides. We're going to start with personal care services. The personal care aide supervisor qualifications. These are for both Passport and Older Americans Act. Only a registered nurse or a licensed practical nurse working under the direction of a registered nurse are qualified to be a personal care aide supervisor. Complete online search upon hire and prior to the license expiring each 2 years. Print the results and maintain them in the employee file. We've provided the e-license lookup website for you. And for Passport only, your trainers and testers must meet these same requirements. Now moving on to personal care aide qualifications. For both Passport and Older Americans Act, the following slides are referring to Passport and Older Americans Act PCA qualifications. An applicant or employee must meet one of the following requirements. The first qualification that we're going to discuss is under the title of STNA. Successful completion of a nurse aide training and competency evaluation program, NATCEP for short, and is listed on the Ohio Department of Health's Nurse Aide Registry as active or in good standing. In the past, we were directed by ODA that we could accept expired status. That is no longer the case with the new rule changes. ODA no longer accepts expired status. So make sure when you are reviewing prior to employment that you look at the nurse aide registry and make sure that the applicant is listed as either active or in good standing. For verification, please retain a copy of the search results from ODH's nurse aide registry. Again, under STNA, successful completion of a nurse aide training and competency evaluation program approved by ODH under section 3721.31 of the revised code. These are people who have gone through the NATCEP training but are not listed on the registry. Maybe they didn't take the state STNA test, or possibly they failed the test, therefore they are not listed on the registry, but should have received a certificate showing that the NATCEP program was completed. So please retain a copy of the certificate of completion. In addition, record the following information and retain it if it does not appear on the certificate: the training dates, locations, hours completed, instruction materials used, subjects covered. Then to verify the accuracy of the record, the name, qualifications, and signature of each tester and trainer. We will accept a valid certificate titled Nurse Aide Training and Competency Evaluation Program. If you have questions, do not hesitate to contact us. If you have questions about legitimate training sites, please see the website listed here on this slide. Also listed are instructions for downloading the STNA program locator. Follow the instructions provided as needed. The second qualification that we're going to discuss is for both Passport and Older Americans Act. It's listed as Medicare. Successful completion of the Medicare Competency Evaluation Program for home health aides without a 24-month lapse in employment as a home health aide or nurse aide. So again, I would like to stress that this competency evaluation program needs to be completed, and there cannot be a 24-month lapse in employment as a home health aide or nurse aide prior to employment. Again, like under the STNA verification, please retain a copy of the certificate of completion. In addition, record the following information and retain it if it does not appear on the certificate: training dates, locations, hours completed, instruction material used, subjects covered, and to verify the accuracy of the record, the name, qualifications, and signature of each trainer and tester. The third qualification is for Passport only. This is listed as previous experience. At least 1 year of supervised employment experience as a home health aide or nurse aide, and has successfully completed a competency evaluation covering topics identified in the 60-hour training requirements. The competency evaluation is your written and skills testing. Again, I want to reiterate that this qualification is for passport only. If you are approved to provide services for Older Americans Act for personal care or for homemaking, you cannot utilize aides with previous experience because they do not qualify under the Older Americans Act requirements. Erin will continue with more information on the homemaking aspect later in the presentation. So for all Older Americans Act providers, we do highly recommend that you do an inventory of those aides providing personal care and check to make sure that they are qualified. If not, make sure they are educated as soon as possible so that they meet OAA qualifications. So again, for passport only, we have previous experience listed. And for verification, we please ask that you retain records to verify the person's name, the former employer's name and contact information, the former PCA supervisor's name, the date the person began working for the former employer, and the date the person stopped working for the former employer. The fourth qualification for both Passport and Older Americans Act is listed as vocational programs. Successful completion of the Koala Home Health Training Program or a certified vocational training and competency evaluation program in a healthcare field covering the topics identified in the 60-hour training requirements. And again, they will be required to have written and skills testing. For verification, retain a copy of the certificate of completion. In addition, record the following information and retain it if it does not appear on the certificate: the training dates, locations, hours completed, instruction materials used, subjects covered, and to verify the accuracy of the record, the name, qualifications, and signature of each trainer and tester. The fifth and final qualification we will be discussing for personal care aide is listed as other programs. Successful completion of a training and competency evaluation program with the following characteristics. The training lasted at least 60 hours, and all subjects were included in the training and competency evaluation: communication skills, observation, reporting and retaining records, reading and recording vital signs, infection control, basic elements of body functioning, maintaining a clean, safe, healthy environment, recognition of emergencies and procedures, physical, emotional, and developmental needs of individuals, personal hygiene and grooming techniques, meal prep and nutrition planning. Please look at the rules closely for the specific requirements related to these topics. This is a condensed version. When the previous slides referred to competency evaluation or covering the topics in the 60-hour training requirements, these topics, these subjects listed above are the topics listed. Continuing for verification of the 60-hour program, please record the following information and retain for your records: the training dates, locations, hours completed, instruction material used, subjects covered, then to verify the accuracy of the record, the name, the qualifications, and signature of each trainer tester. This is not a new requirement. We do suggest a daily sign-in and sign-out sheet verifying the topics covered each day and the hours devoted to each topic. For all of these qualifications, we just want to note that we will be paying particular attention to all of those employees that have been hired on or after 5/5 of 2018. Next, we will discuss additional training. The provider shall conduct additional training and competency evaluation for PCAs who are expected to perform activities for which they do not receive training or undergo competency evaluation identified in OAC 173-39-02.11 C3A and OAC 173-3-06.5 B2A. Some examples would include the following: training for use of a Hoyer lift or any specific equipment that may be used, or ostomy care or any specific care procedures not covered in the Aide's basic training. For verification, please record the following information and retain for your records: training dates, locations, hours completed, instruction material used, subjects covered, and to verify the accuracy of the record, the name, qualifications, and signature of each trainer and tester. This covers the personal care requirements that we're going to review today. Aaron Davis will continue with homemaking requirements.
Hello, this is Erin Davis. I am the Provider Development Risk Assessment Specialist at Buckeye Hills Regional Council. As Rhonda had said, I will be continuing the presentation starting with Homemaker service. Homemaker Supervisor Qualifications for Passport and Older Americans Act. OAC states an applicant or employee shall meet at least one of the following requirements: a bachelor's or associate's degree in a health and human services area. For verification, you should maintain a copy of the person's diploma. The second qualification is a current valid license to be a registered nurse or a licensed practical nurse under the direction of an RN. For verification, you should maintain a copy of the person's licensure as previously reviewed in the PCA supervisor qualification slide. Qualification number 3 would be at least 2 years of experience as a homemaker aide. For verification, you should maintain documentation just as what is required for the PCA qualification for previous employment experience that was reviewed earlier in this presentation. The following slides are referring to passport homemaker aide qualifications. An applicant or employee must meet one of the following requirements. Most of these qualifications will mirror passport personal care aide qualifications. However, pay close attention because there are slight variances in the way passport homemaker rules are written in comparison to how passport personal care rules are written. Therefore, the homemaker aide qualifications will differ slightly from the personal care aide qualifications. With that being said, we are all responsible to follow how the Ohio Administrative Code is written because ultimately these are ODA's expectations. Passport homemaker aide qualification number 1, STNA. The applicant or employee must successfully complete a nurse aide training and competency evaluation program and be listed on the Ohio Department of Health's nurse aide registry as active or in good standing. For the documentation you should maintain on the employee's file for verification, please refer to the PCA qualification for STNA, which was reviewed earlier in this presentation. There should be a copy of your search results from ODH's Nurse Aide Registry website on the employee file for verification. Again, please ensure the status of this individual is either active or in good standing. If not, they would not meet this qualification. Passport homemaker aide qualification number 2, STNA or NATSEP training. The applicant or employee must successfully complete a nurse aide training and competency evaluation program approved by ODH under section 3721.31 of the revised code within the last 24 months. This qualification is referring to an individual who completes an ODH approved NATSEP training course but does not go on to become state tested. Keep in mind that there is a 24-month time frame requirement identified in this rule, which is different than the personal care qualification requirement. For the documentation you should maintain on the employee's file for verification, please refer to the PCA qualification for STNA. Again, that was reviewed earlier in this presentation. Passport Homemaker Aide qualification number 3, Medicare. The applicant or employee must successfully complete a Medicare competency evaluation program for home health aides without a 24-month lapse in employment as a home health aide or a nurse aide. For documentation you should maintain on the employee's file for verification, we ask that you refer to the PCA qualification for Medicare training reviewed earlier in this presentation. Passport Homemaker Aide qualification number 4, vocational programs. The applicant or employee must successfully complete a Koala home health training program or a certified vocational training and competency evaluation program in a healthcare field covering the topics identified in the 60-hour training requirement, as well as written and skills testing. For the documentation you should maintain on the employee's file for verification, please refer to the PCA qualification for vocational programs reviewed earlier. Passport Homemaker Aide qualification number 5, 20-hour training. The applicant or employee must successfully complete at least 20 hours of training and skill testing by return demonstration that include the following topics: universal precautions, meal prep, laundry, basic home safety, house cleaning skills, body mechanics, communication skills, emergency protocols, and documentation skills. Verification requirements. Record the following information and retain it in the employee's file: training dates, locations, hours completed, instruction materials used, subjects covered, and to verify the accuracy of the record, the name, qualifications, and signature of each trainer and tester. This is the 5th Homemaker Aide qualification identified in the Ohio Administrative Code for Passport, which is not a personal care aide qualification. Older Americans Act Homemaker Aide qualification. The provider may only allow an aide to provide the service if the provider retains a record to show that the aide successfully completed at least 20 hours of training on the topics that include successful passage of written testing and skill testing by return demonstration. The topics are as follows: communication skills, universal precautions, homemaker service, recognition of emergencies and knowledge of emergency procedures, basic home safety, record-keeping skills. For verification requirements, again, you would record the following information and retain it in the employee's file: training site information, date of training, number of hours of training, a list of instruction materials and the subject areas covered, qualifications and signatures of the trainer and tester verifying the accuracy of the record, and all testing results. This is the only Homemaker Aide qualification identified for Older Americans Act in the Ohio Administrative Code. Buckeye Hills Regional Council has and will continue to accept proper verification of the following qualifications, as the training courses include the required elements identified in this rule. Please remember that you must follow all of the requirements that have been reviewed in previous slides during this presentation to verify compliance. To summarize, we will accept the following qualifications as long as there is proper documentation in the employee file to verify compliance. STNA, if the applicant or employee is listed on ODH's nurse aide registry as active or in good standing. STNA, if the applicant or employee has completed an ODH approved NATSUP training. Medicare home health aide training, including written and skills testing, Koala home health training program, or a certified vocational training and competency evaluation program in a healthcare field, covering the topics identified in the 60-hour training requirement, including written and skills testing, Passport PCA 60-hour training course. As long as Homemaker tasks are included and identified as being part of the training, and again, it would include written and skills testing. And lastly, Passport Homemaker Aide 20-hour training course, including written and skills testing. Passport and Older Americans Act Homemaker Aide qualifications. Before providing Homemaker Aide activities to an individual, the provider shall conduct written testing and skill testing by return demonstration of all Homemaker aides not listed on the Ohio Department of Health's Nurse Aide Registry for all subject areas listed in the 20-hour training requirement. Verification requirements: retain documentation to include training site information, date of training, number of hours of training, a list of instruction materials in the subject areas covered, qualifications and signatures of the trainer and tester verifying the accuracy of the record, and all testing results. Moving on to personal care and Homemaker Aide continuing education requirements. The provider shall retain records to verify that each aide successfully completes 8 hours of continuing education every 12 months, excluding agency orientation and program-specific orientation. This is a requirement for PCAs and Homemaker aides for both Passport and Homemaker, or for Passport and Older Americans Act. Please retain in-service information, including the following information: date the in-service took place, number of hours completed, a list of instruction materials and subjects covered during the in-service, and the signatures of the trainer and tester to verify the accuracy of the record. All staff orientation. This is a requirement for personal care service and Homemaker service for Passport and Older Americans Act. Before allowing an aide or other employees to have direct face-to-face contact with an individual, the provider shall provide the employees with orientation training that, at a minimum, addresses the following: expectations of employees, ethical standards, overview of personnel policies, incident reporting procedures, organization and lines of communication, and emergency procedures. As a side note, we would ask that proper communication channels are reviewed with your aide staff. If an aide has a concern or question about an individual's services, the appropriate person to report that information to would be their immediate supervisor within your agency. Calling the individual's case manager would be the responsibility of the aide supervisor or the individual, not the aide. As Rhonda stated earlier, we highly recommend that you complete an internal audit of all of your aide and aide supervisor staff employee files to ensure you have proper documentation to verify compliance to the current rules in effect. We are available to provide guidance, so please feel free to reach out to us if you have any questions. Next, we would like to take this opportunity to update providers regarding the waiver alignment plans implemented in collaboration with the Ohio Department of Medicaid and the Ohio Department of Aging. As far as background, the reason this is taking place is that the Ohio Department of Medicaid has identified that the current waiver system has issues with duplication and other obstacles. These issues can then in turn affect waiver recipients, providers, case managers, case management agencies, and managed care plans. ODM and ODA are planning to align waiver design and policy of the MyCare Ohio, which is managed care, Ohio Home Care, Passport, and assisted living waivers. The alignment is going to be achieved by amending the Ohio Administrative Code rules, vendor contract requirements, and sub-regulatory guidance. Phase 1, which started January 1, 2019, started the alignment of 6 waiver services and rates, and also clinical practice standards alignment, which will be ongoing work throughout all phases. Phase 1.5 is estimated to start spring of 2019, and that will include alignment of an incident management process and development of a single incident management system. Phase 2.0, anticipated for July 1 of 2019, will include alignment of a minimum of 2 waiver services, and this phase will also include modifying waivers to capture home choice. And beyond Phase 2.0, continued alignment of waiver services, consistent model of participant direction across waiver delivery, 1 agency front door for providers, and 1 monitoring system for providers. Phase 1 waiver alignment, which took effect January 1, 2019, included the alignment of the first 6 waiver services for OAC Chapter 5160-44, home delivered meals, home modification, personal emergency response system, out-of-home respite, waiver nursing, and home care attendant. ODA has completed rule updates in Chapter 173-39 of the Ohio Administrative Code for the services listed above. Please go to ODA's website to print the latest rules that are in effect at aging.ohio.gov. Also, as we have in the past, while you are on ODA's website, we encourage you to sign up for automatic email alerts regarding rule updates. This will ensure that you and your staff have an opportunity to make comments during a public comment period, and it will allow you to have access to the most up-to-date rules ODA has available. The last topic that we will be going over during this presentation is electronic visit verification. The slide on your screen now shows what the 2 devices that ODM will be providing to individuals. ODM has started the implementation process, which includes 3 phases. Phase 1 was implemented January of 2018 for state plan home health services and Ohio home care waiver. Phase 2 is expected to be implemented January 1 of 2020 for managed care and the Ohio Department of Aging passport, which would include waiver nursing, personal care, and home care attendant. And Phase 3 is expected to be implemented January 1, 2023 for self-direction. What you need to know. We cannot stress enough how important it is for you to ensure accurate contact information is provided to the Ohio Department of Medicaid and the Medicaid Information Technology System, referred to as MITS, as well as to ODA through us here at Buckeye Hills Regional Council. If you fail to meet the deadlines implemented by ODM, it will result in the reduction of federal financial participation for services. And we also wanted to let you know that there will not be any changes as far as your structural compliance reviews for passport services goes. The review process and requirements for paper documentation remain the same as they are now. ODA has a link on their website to provide you information regarding EVV and a link to ODM's website at aging.ohio.gov. We recommend that you utilize this link as much as possible. There is a wealth of information made available by clicking on For Professionals and then EVV. Providers can request 1 device per provider number from ODM for training purposes. Providers cannot bill ODM for any training regarding EVV, as Medicaid only reimburses for medically necessary services. Non-agency providers are required to use the Sandata system. The system is free of charge for all providers, as well as all individuals. If agency providers wish to utilize another system that meets all of ODM's requirements, they are subject to additional charges to ensure the system is compatible with SANDATA. What should you already be doing? Again, updating your email and phone number for service location and MITs. Don't miss updates. See ODA's website, aging.ohio.gov. Share this information with your employees. Talk to the individuals you currently serve. Review ODM's EVV website. There you will find information you need, as well as helpful training videos. Look for information for training registration to be posted on ODM's website on April 1st, 2019. If you have completed the Phase 1 training, you should not attend the live training options that will be posted on April 1st. ODM will offer a gap training for those who have completed Phase 1 training that will be offered via webinar. If you have not completed Phase 1 training, ODM highly recommends that you attend a live training session for hands-on training. Webinars will be offered, but will lack the hands-on experience. Keep in mind that ODM is limiting the number of participants per provider number for the live training sessions to 2 individuals per provider number. And there is no limit to the number of individuals that can participate in the webinar training that will be available. ODM should always be your point of contact for any questions related to EVV. For provider assistance, please contact ODM by one of the following ways. As stated during the opening of this training session follows along with the rules that are currently in effect as of March 19th, 2019, the date this presentation was recorded. It is not intended to take priority over current rules, but to serve as a helpful guide. We thank you for your participation in this training session. Our hope is that we have provided you valuable information to better assist you in following program requirements. Please submit questions to us at providercertification@buckeyehills.org no later than April 17th, 2019. This will allow us to compile the questions and submit a response to all of you in a timely manner. And as always, we thank you for the quality care that you provide for the individuals in our region.